Hi everyone, my name is Julie Peterson. I'm a psychiatric nurse practitioner student at Purdue University Global. I am currently working as a family nurse practitioner at a multi-specialty clinic. I work in internal medicine with two supervising physicians. I call them the yin and the yang. One is an introvert, the other is an extrovert. So they're both very good and I get a lot of feedback on, my medical decisions that I make for them. So, some of the specific areas that I'm anxious about in psychotherapy just continues to be just talking to the patients. I know that the way that you present yourself and that you present options and kind of the patient's possible diagnoses to them, that actually contributes to how they go forward in life. I know sometimes it could just take just one person to make a difference on people. So I hope I can do better in that as I go through the program and the course and just more interactions with patients and get some feedback from either my instructors or from my preceptor. So she's very good and I appreciate her. Um, Specific issues that I find bothersome or topics that I find bothersome to me, I guess just really not taking accountability for one's actions. I've kind of always been, maybe a little, um, you know, just self-regulated in that regard, that I've just kind of always spoke up to what I've done, whether it's been good or bad. And I know I have a lot of personality issues, just basically dealing with my own self and kind of black and white thinking. I have a lot. So I try to work on that and to try to, maybe help the patient see that there could be some shades of gray. So triggers for me that I see are um, probably just sometimes that things are just really sad, and it's not the patient's fault. It's nothing that they did. It's just kind of something that happened to them, and it might not even be society's fault. It might just be an accident that happened that they witnessed, that it is just really difficult to get over. So that just kind of makes my heart just cry, just seeing what the patients go through sometimes, and it just happens to be what it is, and it seems to be out of pretty much everyone's control. So anxieties of my own to just kind of better assist the patients is to just be very engaged with what I'm doing with my patients, talking to them. I'm trying to come up with ideas for them. And I think that the patients in the medical field that I deal with are, they know their body's the best. They know where they're at the best. Of course, they can talk to me and tell me this and that, but when it comes down to the 15 minutes that you basically have with a patient, the they just know themselves best. They've known themselves their entire lives. So sometimes I think if you give them a little bit of homework and give them something to think about, that can help. And I think that some of the anxieties that I have would just kind of really be helped by thinking a little bit more about my patients and trying to help them kind of through what they're going through, and just trying to do the best that I can, and just thinking about some of the responses or the reactions that I had to the patients afterwards, and getting some feedback from my preceptor too. So if you have any questions, comments, or concerns, please feel free to give me a call or email me. I'll be happy to hear you. Thank you. Bye-bye.